Good morning, everyone. I wanted to start by explicitly indicating that was Dr. Rebecca Haynes-Saw, who is a faculty member at the University of Calgary, population health researcher, and she is I would say, she has worked with a team of people, but she has been the lead organizer of today's event. So thank you, Rebecca. We will hear more from her later. So, as Rebecca has said, my name is Bill Ghali. I'm the scientific director of the O'Brien Institute for Public Health, and we are one of 7 health research institutes at the University of Calgary. And we are a big institute that includes over 400 members spanning many different faculties at the University of Calgary, as well as many different health agencies, public health agencies, and other entities. So a large proportion of our membership is from Alberta Health Services, some members from the Ministry of Health, some from the City of Calgary, and some from a variety of community-based agencies like CUPS, the United Way, and so on. And with this broad and diverse membership, we are trying to advance knowledge and convene discussions around knowledge to advance the extent to which we can achieve better health and health care in this province, certainly in this city, Calgary, but then nationally and internationally. And we have a number of partnerships that are pretty far-reaching. We know that the end game is to provide information and convene discussions around information so that we can advance policy discussions and inform policy in an evidence-based way. So we're trying to seek a paradigm of evidence-informed policy for health. And we embrace the notion that while there is a construct called quote-unquote health policy, we can also think about health in all policies. That's to say that while we might be talking about transportation policies or housing policy or taxation, well, any policy in the public policy realm will tend to have a health implication. And so as an Institute for Public Health, we're thinking about policies that influence health and policies that come from many different ministries of government, from all the levels of government, and from agencies that have regulations that can affect health. So today's event is in that realm. We all know when we look at a newspaper, listen to a radio, or watch television, that the legalization of cannabis is a very significant public policy discussion that's really at the top of many people's radar screens right now. And so this is a particularly timely symposium, and I thank Rebecca and colleagues for organizing the event. This is an event where there's going to be some opportunity to interact, and then also ultimately and most importantly an opportunity to listen and learn. And that's what I'm going to sit back and do as we move into the program. The program has 3 thematic portions, and I think you'll see as the day unfolds that they're all relevant and they're somewhat distinct. The first theme, which will be the focus in the morning, is on medical use and access to cannabis. So that's a context, and we'll learn about some of the medical indications for use of cannabis, some of the evidence, and how to go about actually having distribution mechanisms for such. In the afternoon, we'll switch gears to the bigger question of the legalization of cannabis and what some of the public health implications are. And many of you will have heard of the discourse of shifting away from the legal criminal model for controlling cannabis use to thinking about it from the standpoint of a legal substance and public health approaches to control. So that's going to be the second theme. And then the third theme will be a focus to youth and implications of all of this to youth, and are there special concerns, are there age considerations? And I know, again, we sense from the registration surveys that you are a very engaged and and invested audience in this event. So without further ado, I'll turn it over to Dr. Aleem Barwani. Aleem was one of the key members of the planning group. Aleem is also one of our council members for a new health policy center that we have within the O'Brien Institute, and his passion is public policy and public policy for health. And Aleem, I'll turn it over to you to set the stage for today. Thank you.